Hi, I'm Dr. Richard Jermyn, Dean of the Rowan-Virtua School of Osteopathic Medicine. Welcome to Dialogue with the Dean, our podcast series dedicated to highlighting the thought leaders who are advancing the mission of our medical school. Our mission is to foster innovation, excellence in education, and transformative healthcare practices. Today, we are thrilled to have Dr. Silliman Cohen, Director of the Rowan-Virtua Child Abuse Research, Education, and Service, CARES Institute, Associate Professor of Pediatrics at Rowan-Virtua School of Osteopathic Medicine, and Adjunct Faculty at CMSRU. Dr. Silliman Cohen is dual board certified in pediatrics and child abuse pediatrics and oversees the clinical, educational, and research activities of CARES. She's expertise in caring for youth who are at risk for or engaging in human trafficking, wellness for LGBTQA+ youth, and a special interest in equality, diversity, inclusion in medical education and clinical practice. Welcome.
Thank you so much. Thank you.
Is there anything in what I just mentioned that's not our mission here at Rowan-Virtua School of Osteopathic Medicine?
I mean, we're the mission. CARES is the mission. That's why I came to Rowan, was the mission of the School of Osteopathic Medicine.
Warms my heart because I think that is what brings in our students here. They want to be engaged and be part of exactly what you're putting together here. So I'm very, very happy to hear that. I do want to point out one special hello, and that's to your daughter, and a shout out, best shoes ever.
Thank you. She did choose them, you're right.
So, yeah, I heard she chose them for you today, and I just want to give her credit for that. Good choice.
Thank you.
So let's talk a little bit about CARES.
Yes.
Okay. Explain to us, what is CARES?
Yes. So CARES is one of the institutes at the School of Osteopathic Medicine. We are interdisciplinary. We have medical providers, we have mental health providers, we have lots of amazing staff members. And our job is, as you said, we are the mission. Our job is to care for kids and families who have experienced trauma. So abuse and neglect is the main thing. We have a program also for kids in foster care, and we also have a program now for kids who've experienced human trafficking or who are at risk for human trafficking. So we provide medical care and we provide mental health care for these populations of New Jerseyans. We also do medical and mental health research and education as well. So we're one of our interdisciplinary institutes, and that's one of our big values, is making sure we work together to care for our patients.
So what are some of the innovative strategies that you've put together at CARES that are having a real significance on the well-being of our children?
Yes, so we sort of at the macro level, my co-director, Dr. Esther Deblinger, did create or co-create the model trauma-focused cognitive behavioral therapy, and that has reached millions of people, is being used across the globe, and she continues to do research on that modality to treat trauma in children and in families. And there's lots of evidence to show that it's quite effective. So that's one innovation that we've been known for historically and that we continue to be known for. Some of the other things that we do are newer. We focus on, when we see children and families, we focus on consent language and education. We work really hard to work with our patients and families about them being empowered about the process, making sure they know exactly what's happening, making sure they understand that even though they're there to talk about a trauma that they've experienced, they're also there to practice how to be powerful in their own bodies, how to learn about their own health and their own mental health. And I really think that that's a really big part of what we do in our day-to-day practice. We have programs now where we also focus on resilience for our providers themselves, because we know that people who take care of children and families who've experienced trauma can experience trauma themselves. We see that with our partners outside of medicine and mental health, and we see that within medicine and mental health. So we think a lot about how to care for our faculty, and staff as they do the work that they do. And I would say the final thing that is an innovation and that we do every day, we think about how to find joy in the work that we do. We celebrate kids when they have finished their trauma therapy experience. We make sure that kids come out of the exam room knowing that their bodies are healthy and strong. We talk with families about the language that they can use to talk with their children about the trauma they've experienced so that they have words. We know that trauma happens. We can't take it away. I wish I could. That if I could work myself out of a job, I would. But we can't. But what we can do is provide families and caregivers with tools and language so that they can understand and incorporate the experiences that their children have had so that they're empowered and educated moving forward. We know that that is an effective way for children and families to be okay in the future.
Can I go back a little bit to human trafficking?
Yes.
When I look at the data and the sheer numbers that we're talking about, it's huge.
Yes.
What are some things that all of us that are listening to you right now can help?
Yes, I'm so glad you asked. So it's a huge number of children, and it's actually hidden. A lot of people who are experiencing trafficking, both sex trafficking and labor trafficking, are hidden. We don't know about them, and it's not something that we see because it's not something anybody talks about, and it's because it's a hidden crime. So for children and adolescents who have experienced trafficking, some of the things to think about are they're not only those children who, for example, are from other places and who are being kept in terrible circumstances against their will. Some of them might be in school. Some of them might be trafficked by people in their families or in their life circumstances that they know. It's something that's far more common than we realize. So when we see children and adolescents who may have experienced trafficking, if they talk about something that has happened, my best recommendation is you believe them, because things happen that we could never imagine when you look at a child or in thinking about the experiences that they've had. Some of the other things to think about that I think are really important is the work that we do with trafficked youth and youth who are at risk for trafficking is we have to listen to them with the care we give. So our model is a patient-led model. We have individuals who are survivors of trafficking who have contributed to how we have created our clinic, who have contributed to the models that we use to provide care. That's really important, to work with survivors, to work with people who have had lived experience, to do the medical and mental health treatment. That's incredibly important. And then in the day-to-day, working with youth in front of you, it's really important to listen to them. If they say, yes, I'm willing to, have this one blood test, but I'm not willing to have this part of the exam. That's important. They're telling you something. So my best advice is to stop, listen, and try to meet their needs as best as you can as a provider, because they don't have a lot of power in other parts of their lives. So if you can give them the power in your relationship with them in the exam room or in your office, it makes a big difference. We know that kids who have been trafficked do very, very well with relationships. So some of the most important things we can do in any role as medical provider, mental health provider, educator, community member is to build relationships, even if they're difficult relationships to build, because even one important relationship with an adult, with a safe adult, with a caring adult for a youth is protective in the long term for their medical and mental health. And we know that because there's clinical evidence to show that. So just building those relationships and being there for them, even when it's difficult, even when you don't quite know what's going on, is really important. So those are some of the things that are important.
I'm first of all, I'm enamored by this conversation. So thank you for talking about this very sensitive issue. Your work is amazing, I just want to say. And I know I'm speaking for our audience today. We are Some of our audience may be hearing about you for the first time.
Yes.
And so I'm very glad that you agreed to do this podcast with me so I could show the work to our community.
Thank you.
And I'm going to tell you, we're going to show this, and the first question I'm going to get back is, as part of our internal community, what can we do to help you?
Oh, thank you for asking. There's many, many things to do. So there's, at the level of learners, of course, which is the most important thing of what we do. Medical students and residents can rotate with us. It can be medical students at all levels in the way that they rotate with anybody. Residents, pediatric residents in different institutions, but also family medicine residents and other trainees can rotate with us clinically. We have lots of new research projects that are happening right now. We have one that we're working on about trauma in medical students and also provider knowledge of trauma. We have another about torture victims, and we have other research projects that are growing, and we're always looking to collaborate with more individuals across the university. We have initiatives that have been run by our community members. We had a backpack drive that was run by medical students last year, and we use those backpacks to give to kids in foster care, to give to kids who are at risk for being trafficked, because we know that a lot of our patients leave their home environment without anything or without very much. So for us to be able to give them a backpack with toothbrushes, a backpack with coloring pages, with a stuffed animal, any of these things is really meaningful. So there are lots of ways to help our patients with direct service and donation. And then of course, in the way that all of our institutes need, donating to the School of Medicine and to the university can be really helpful and important as we grow our institution and as we work to serve more New Jersey children and families.
Yeah, I think it's very interesting, the work that you do. It's a little different than when most people think you're going to a doctor and you have diabetes or you have high blood pressure, or in my world, back pain or substance use disorder. It really is a different way of looking at medicine, and you're way ahead of the world in this. In fact, you're creating the standards for the globe. This is, again, I'm enamored by the work that you do.
Thank you.
There's a lot here, but what do you do for fun?
What do I do for fun?
Yes.
I spend time with my family. I have 2 children and my wife, and we play outside, do things that my young children like to do. I read, I ride my bike, I go running, and I exercise. I do a lot of yoga. And we know actually that all of that is really important in the work that we do, both as a provider in the realm of trauma, but really anybody, any provider, any person who works with other people. It's really important to take care of yourself. But so, I do a lot of things with my body and a lot of things with my family in order to have fun.
Well, I just want to say thank you and your team for the work that you do. I don't think I'm speaking out of turn by saying that it is so mission, it is so who we are at Rowan-Virtua SOM, and truly our future sits in your work, and that's our children.
Thank you.
So thank you so much for that. And I want to thank our audience for tuning in once again to meet these amazing individuals who are really moving our mission forward. And please stay tuned. I'll see you guys next month. Thank you. Bye.